everyone, how are you? My name is Dr. Perez, also known as This is Norma Norma Itzel. This will be my very first time speaking to you guys in English. I know most of my audience is Spanish speaking, so you can stay on this video and just click on closed captions in Spanish. I wanted to do this video in English because right now I'm based in Jacksonville, Florida. I'm graduated from, oh, this is my cat, Kelly. I graduated from college 2 years ago from a Mexican university, and I've been practicing vet med here in the United States for 7 months now. And this video is about all of my cases that I had today because I just got from work and I still have everything fresh in my memory. So this is not a vlog. If you're expecting to see a vlog, don't go away. If you would like to see vlogs of me actually doing things in the hospital, I can try to do that. The reason why I haven't done a lot of them yet is because it's difficult to handle animals, talk to clients, write down my medical records, and film on top of everything. Also, I'm a little bit camera shy, so I don't know, I don't feel ready yet to become the blogger doctor in my hospital, but I can try. I have one video already that I did like 2 months ago, so if you would like to see a vlog, you can go see it. It's in Spanish, so if you are an English speaker, go there and put closed captions, please. So for today, I believe, I can't remember if I took pictures, like several pictures of every single case I had. I remember I took a picture of a radiograph that I already posted on Instagram. If you don't follow me, you can go check my Instagram. I will link it down below. I asked you a question actually, if you could spot what the problem was. But let me rewind from the very beginning. Today I was the morning doctor. That means I arrived around 8 a.m. and I'm on charge of doing physical exams on every hospitalized patient. Usually, since it's like a general practice, we don't hospitalize a lot of patients because we don't have staff overnight. So we try to hospitalize as less patients as possible, and clients are aware of that we don't have staff overnight. They do hospitalize their pets because the hospital I work at, it's a non-profit organization. That means we have more affordable prices compared to normal general practices. So the public I work with would be considered as low income. Veterinary care here in the United States, it's super expensive. If you think that veterinary care is expensive in Latin America, Mexico, believe me, it is even more expensive here in the States. So yes, a lot of people cannot really afford like full diagnostics and hospitalization in a regular general practice, or even in an ER, an emergency room. Those are much more expensive. So yes, my caseload is pretty extensive. I see from, I would say, 17 to 25 patients a day. I have my schedule full with wellnesses. Those are healthy patients that I do a physical exam and decide if they're healthy enough to receive vaccinations, do heartworm tests, fecal tests, and pretty much that. That's like the annual visit for dogs and cats. But I also have sick appointments. So throughout the day, I have scheduled like 8 to 12 appointments. I have a lunch break, and then I go home. But for example, today that I was supposed to be the morning doctor, I should have left the hospital by 5, and it's almost 7 right now. So I finally left the hospital around 6, to be honest. So that is one of the things that I've been working so hard on, to work my hours and just come home. But it's been difficult because there is a lot of work to do. So going to the beginning again, we have like 13 patients hospitalized. Not every single one of them had an owner, because we also work with animal care and protective services, that they bring cats, community feral cats that they trap, that are ill, limping, are showing issues. So it's not that they have an owner, we just take care of them, do TNR, which is trap, neuter and return. So they stay with us if they need treatments or if they need to be neutered or spayed. This is my matcha. I'm a matcha girl now. So I had like 2 ACPS cats, 2 boarding pets, because they're not patients per se. They are boarding because the family had an issue, and I don't really know why we accepted them, but they've been here with us for a month or more, I think. And then there is another kitten, like 1-month-old kitten, that our CEO just brought in, that we're taking care of as well. And total like 6 patients, like real patients. I'm gonna start with Daisy. Daisy is a 2-year-old pit bull female spayed dog that I first saw on Monday of this week because of vomiting, lethargy. She first came with us last Saturday, and she was sent home with anti-nausea medication and antibiotics, I believe, because come here, because we did x-rays and we couldn't find anything. I saw them, and honestly those looked almost unremarkable, like we would be suspecting a foreign body in a patient that young. But no, didn't really look like that. So we sent her home with medications, but she came back Monday doing worse per the owner. So I repeated x-rays and she was nauseous. I could see that. She wasn't eating anything. So I hospitalized her, and I told this client like, hey, even though x-rays doesn't really look obvious of a foreign body to me, we could always do an explore. I mean, I have 2 options here. I can refer you to a internal medicine specialist so they can perform a formal ultrasound, because we don't do formal ultrasounds here at my place. We have an ultrasound, but we use it for emergency situations, kind of assessing if there is free fluid in the abdomen, or really obvious things like stones, or I don't know, like easy things. We don't really spend like an hour doing a formal ultrasound. We're not trained for that. We are not radiologists or anything. So I gave him that option, or also here with us do an explore, an exploratory laparotomy, to see what we find, because a patient that is vomiting through dysuria, which is a potent anti-nausea medication, that tells me this could be something else, like a foreign body. So he agreed to do the explore. He didn't really want to expend like $200 on a formal ultrasound, or also take Daisy out of our practice, taking her elsewhere and then come back in case she needed to, because that was one of the things. If she did, well, if she received, well, if they did an ultrasound, there was the possibility of still needing surgery. So I told him that, and he wanted to go for surgery from the beginning. So the next morning the doctor did surgery, and guess what? She had a linear foreign body, like a string. It was not a string, it was like a piece of fabric with grass and hair, like, oh, I have a picture, I will put it here. And she had a perforation that can happen when we have a foreign body that it's been there for days or weeks. So there is always risk of sepsis, of more perforations, pancreatitis. So that was the reason why Daisy was not getting any better, because she had perforations and a linear foreign body. So they removed it and she was hospitalized for all of these days until today. She was discharged she was discharged today from the hospital, and hopefully she started eating. I fed her this morning and she ate like 3 meatballs of GI low-fat diet, wet. So that was the good thing. That was what I needed for her to go home. And obviously with treatment like antibiotics, anti-nausea medications as well, and what else? Obviously pain medications. But yeah, that was my first patient. I was so happy to call them and say, hey, you can pick her up now, she's doing better, just keep an eye on her for like a couple days, because obviously after an enterotomy and a gastrotomy, there is risk of those sutures falling apart and having a septic abdomen. So that was my first patient that I saw from Monday that was still hospitalized. Then on the other cage next to her, we had a 1-year-old Malinois female intact dog that came yesterday because of lethargy, vomiting as well, not really wanting to eat. And again, we thought that could be a foreign body. I was not his doctor. I didn't work there yesterday. I went to do surgery at our other location, so I had no idea what had happened, but I read the medical records and x-rays were unremarkable. CBC, completely normal, because I also thought of, what if this is a pyometra? But her neutrophils count was normal. Then on that chemistry, she had both kidney and liver values increased. So why a 1-year-old dog would have these values increased? Toxicity, that's what I thought. So on top of everything, I couldn't do a physical exam. She was growling, so the plan was to sedate her throughout the day, and we did that. And her doctor from yesterday did an ultrasound, unremarkable as well, and repeated x-rays, unremarkable again. So what I told her is, what if this, and also an important thing on the chemistry, hypercalcemia. You don't have hypercalcemia for a lot of things. I mean, you have several differentials. One of them would be malignant hypercalcemia, but you would also see fever. The other would be neoplasias, cancer. But the other that I don't know why I remember that one, but probably because I had a seizuring dog a while ago here in the States. I did a CBC and a chemistry, and the only finding was hypercalcemia. So I investigated, like, why would a young dog would have hypercalcemia, and guess what? I found out that rodenticides, like, I'm not sure about how to pronounce this one, but it's cholecalciferol, which is a vitamin D, could be an ingredient of these rodenticides and can cause GI disruption like vomiting, lethargy, anorexia, lethargy, hypercalcemia. So I told this doctor that that would be on my differential list. Oh, and also increased kidney values, of course. So I feel proud of myself because she told me, well, she wasn't aware of that specific rodenticide, and I showed her, like, this is what could be happening, and she told me, yeah, sure, why not? So we will be repeating a chemist, well, not we, because I'm off tomorrow, but this doctor will be repeating a chemistry on her tomorrow, and see if after IV fluids and medications she will start feeling better. Yeah, but she was ADR this morning now, which means ain't doing right. But hopefully tomorrow morning she will be feeling a little bit better with after IV fluids and everything. But yeah, that's my guess. Then I had 2 blocked cats. One of them I unblocked. Well, I don't know if this is like a thing here in the United States, because in Mexico, where I've been practicing before, we call this a urinary obstruction, like an obstruction, and here is just, I guess, easier to say a blocked cat. So as you might already be aware, blockages in cats are super common in male cats that are stressed, if they're indoor outdoor, or if they're indoor and they live in a multi-cat environment with only 1 litter box, they are prone to develop these conditions, urinary conditions. So I had this one Monday or Tuesday, yeah, I believe Tuesday, and I unblocked him. That means I sedated him, I passed a urinary catheter through the urethra and sutured it and have him on fluids. A good thing is that his kidney values were normal. When we have a blocked cat that is unable to urinate, BUN and creatinine build up in the bloodstream, also phosphorus and potassium, so that can make a cat super sick, being lethargic, with bradycardia, which is extremely risky. They could die. I mean, I've seen cats die because of a blockage, so you need to act promptly. Relieve the obstruction, put them on fluids, pain medications, take care of the environmental stressing factors. But yeah, I had him, and then another doctor on the same day, he had another obstructed cat, so I took care of them today, and my plan was to discharge both of them. So this is a tricky thing. I don't know how you do it, but I think if you wait until a cat urinates on its own during while he's still in the hospital, there is risk of him reblocking again, because as I said, the blockages happen because of a stress, and a cat being in a hospital full of strangers, listening to dogs bark all day, having a urinary catheter and an IV catheter and an e-collar in a cage with a litter box that is not the one you are used to use, with newspaper instead of your litter. So I think all of those are stressing factors. So what I usually do is, once the azotemia, which is increased BUN and creatinine, has resolved, I usually send them home, and ideally if they're eating. Some cats won't eat being hospitalized, but some others will. So that would be the thing for me. Once they and also if the urine starts looking less bloody, those are like the things I would be expecting for them before discharging them. So what happened with the first block cat is that they promised me to pick him up around 11. They never showed up, so guess what? He reblocked again, and I had to resedate him, replace a urinary catheter again. So what I told them is that hopefully we could discharge, I don't know if tomorrow, but probably Sunday. But they need to be there and take him home as soon as we remove that urinary catheter. Otherwise it will be a never-ending story. He will keep reblocking, blah blah blah. For the other cat, owners did show up and they took him home, and well, we will find out if he keeps reblocking or not. What I use for block cats once they are discharged is Sorbium. That is buprenorphine, topical buprenorphine that you applied at the back of the head, like a spot-on flea medication. Onsior, which is an NSAID. That's why I would redo a chemistry just to make sure those kidney values are down again and I can safely use an NSAID in cats. Gabapentin for both stress, anxiety, and pain. And I love probiotics, especially if this is not an ad, I promise. The Calming Care by ProPlan. These are probiotics, basically good bacteria that increase tryptophan, which is the chemical precursor for serotonin. So if we have more serotonin, we have less stress. So I would use a combination of urinary diet, Calming Care, Feliway, which is also not an ad, I promise, which are these pheromones that can help with anxiety in cats, increase the number of litter boxes in the house, and pretty much that, I think. So then what else I had? Another dog that had the same doctor I told you about before, a Yorkie that we suspected a foreign body, but again, x-rays were not obvious. When I say they were not obvious, I mean there was no obstructive pattern, like, you know, full of gas and weird texture in the stomach or intestinal loops. She was a Shih Tzu, a 3 or 4 year old female spayed Shih Tzu that had a previous diagnosis of bladder stones. I won't mention the name of the hospital because probably you will recognize it. I'm speaking to my Mexican followers, especially if you studied in la Facultad de Medicina Veterinaria y Zootecnia de la UNAM, because we do a rotation in that hospital. Comment down below if you know what hospital I'm referring to. So they did diagnostics, urinalysis, x-rays, and I read the medical records. They mentioned a UTI, but nothing else. But asking the owner, he told me that they saw stones, but he couldn't afford surgery with them. So he was here with us today. This little dog was straining to urinate. Her urine was almost entirely blood, small puddles of blood. So before offering more diagnostics, because supposedly he already have that information, I palpated her, and guess what? I could feel the stones with my hand. Poor dog, she needs surgery ASAP. Anyways, since I had to know how severe the, I wanna say, obstruction was, how do I know that she was mildly obstructed? Because her BUN was increased, similar to what happens with a cat that is blocked. Well, her kidney values were also increased, only BUN, but still. So I didn't put her on IV fluids because she could not urinate properly. I gave her a carprofen injection for pain, and the deal was that he could drop her off so we could do surgery if the surgeon had the time. He agreed because that was her best bet. He couldn't afford doing surgery somewhere else, so he dropped her off. And because of this Yorkie with a foreign body, she couldn't do surgery on my patient, which is fine. I mean, we were all tired. We left the hospital 5:36, so that's fine. But she will do surgery Sunday. Even though she has like 5 procedures, she will just do hair as well, and I'm so thankful for that. So yeah, that was another patient I had. That was a walk-in, by the way. I did several wellness exams today, but I also dealt with a lot of walk-ins, as you will see throughout this video. That was the first walk-in, I believe. No, wait, no. The first one was a cat with a... He was making a noise with his mouth. I couldn't see it or listen to it. I did a physical exam. I couldn't find anything wrong with him, so I sent him home. I did x-rays. I did that because what if he had something stuck in his throat? I did look under the tongue because they can have strings attached to the tongue. Nothing. So I sent him home with just, please record a video of him doing that sound. But he was eating, drinking, not vomiting, no nothing. So that was my very first walking. Then the second, I wish I remembered. I think that was an easy one, so that's why I don't remember. My third one was the bladder stones. I wish I took a picture of that. That was really cool, but I'm almost certain I didn't. I'm sorry. I didn't know I was going to film this video then. Then I had, because this video is it's getting longer than I expected, I'll just jump into the challenging cases I had later in the day. I had 2 dogs that were hit by a car. The first one had this like limp in the right forelimb. It was like he was dragging the limb. So what I've seen before is in hit by car patients, we have like brachial plexus injury or avulsion. That means all of the nerves that connect the spinal cord with the arm are damaged, so they are no longer able to use the arm. So that's what I thought, but then I could palpate everything. The arm felt swollen, and I felt something weird up here in the elbow, like a crackling. No, not a crackling, like something was odd with this joint. So I took x-rays under sedation because he started acting weird after that. He was an 89-pound dog. And guess what? He had a luxation. So I wish I could tell you I fixed that, but I didn't. I sent them to the specialist because the accident happened Saturday. It's been almost 7 days, so chances of him not really resolving after the procedure of the reduction would be significant. So, and I would need to intubate, place an IV catheter, call our surgeon that does a lot of orthopedics that was in Speed Lane vaccinating a bunch of dogs and cats. It was later in the day, so I just thought it was a lot of things to do, and that probably the best bet for him would be just go with an specialist. There is a doctor that also works in a non-profit organization that does a lot of orthopedics, so I sent them there with obviously pain medications. I injected the dog with carprofen and also send them with gabapentin and more carprofen. But yes, that was one of the hit by car, and the other, oh my god, this was the saddest. This is a 1-year-old female intact dog, mixed breed, that they think that was hit by car because all of a sudden, well, she was gone for the morning, but then she came back and she was dragging her back legs. So that automatically makes you think of, what do you think? If you see a dog that, you know, has been hit by a car and is dragging the back legs, what would you think? I will give you 2 minutes. You can pause this video and write down what do you think might have happened. So long story short, I will let you know what my findings were when I did the physical exam. She was panting. She was trembling, obviously in discomfort. She was painful. She was in a gurney when I first assessed her, so I couldn't see if she was walking or not. So I put her on the floor and helped her. And well, before that, doing that, I gave her a ibuprofen injection as well. And then I evaluated her neurologically. So she had a negative withdrawal reflex. That means whenever I pulled the toes, she wouldn't, you know, retract the leg. So that tells me, yeah. But she had deep sensation present, so that carries better prognosis opposed to having no sensation at all. I took an x-ray of the spine, of the TL segment of the spine, and guess what? This is what I found. Could you guess where the injury is? So yes, these two vertebrae were like this. This would be a luxation of these two vertebrae, and obviously the spinal cord goes all the way down through that canal. So obviously the spinal cord was being not pinched but compressed by those two bones. That makes a patient excruciatingly painful. So what I told her is she has better chances and a better prognosis if you take her right now to a neurology specialist, to a neurologist, and perform an MRI and surgery to give her some sort of stabilization or, you know, fix this. She called several places, like specialist places, and ultimately she told me, well, not me, not myself, but my tech, that her aunt was a vet, so she would take her home with pain meds and figure out the rest with her. So it's a debate whether or not to use steroids in, I wanna say, well, not neurological patients, but you know, head trauma, medullary injury patients. From what I've learned from my neurology and orthopedic rotation back in those days when I was an undergraduate, I will link here, and also if you want to go see how that looked like a while ago. So the specialist back in Mexico would say never use steroids in a medullary injury or in a head trauma case. Here I asked 3 doctors, because I worked with 3 other doctors today. 2 of them told me steroids. I had already done the ibuprofen injection, so that wouldn't be an option. And honestly, if even I hadn't done that already, I would probably still skip steroids. Then I asked another doctor, and she told me that the best thing that I could do for that patient was just to refer and have the surgeons decide whether to use the steroids or not, and I agree with that. So I sent her home with gabapentin again, carprofen, yes, for pain, because I don't think only gabapentin or gabapentin only will be enough to make her comfortable, and metocarpamol as well, just to help her a little bit more. So yeah, let me think. I have for sure more patients, but I don't want to make this video any longer. So to my Mexican and Latin American and Hispanic audience, thank you very much if you stayed through all this video. Let me know if you would like me to continue making videos in English so you can practice the language, because most of you, or a lot of you guys, ask me like, how did you learn English? Is there any courses that you took? My advice would always be, if you're interested in learning a language, listen to music in that language, watch movies in that language, try and communicate with native speakers. So I wouldn't say that my English is definitely not the best. I do my best. I was hesitating if doing this video in English or not, but then I just said, you know what, let me just do it and see if it's a success or not. So here I am doing this video in English for you guys. Let me know what you think, if you would like me to continue doing videos in English. What else? Yeah. Thank you so much for watching, and I will see you in the next one. Adios.